in February. So I've got lots of stuff to give out. Romantic dinners at Movenpick Airport View Hotel. I've got a COVID compliant spa treat. If you can answer some good questions and show me that you're a loyal listener of Ultimate Health, your ultimate guide to healthy living, this and every Sunday. 2:05, we are live with me, Norte by Nature. So I'll do my lovey-dovey mood. But I'll also speak to Dr. Michael Owusu of the KCCR. He's a virologist. He's been giving out some recommendations and some cautions. So let's get lovey-dovey. Get ready to call me. You might win a dinner for two. COVID compliant as well. Stick and stay.
Yes, sweetheart.
Keeping safe.
I want you to know something, alright? See, every day in my life without you.
I'll speak to Dr. Michael Owusu, virologist with the KCCR. He had some recommendations. I'll also rattle the numbers, the current numbers for you. And remember, as soon as I activate those phone lines, you get to win a dinner for two, COVID compliant, of course. Our numbers are going up. We're getting all lovey-dovey. It's Valentine's Day. I want to know, how have you been keeping safe? All right? What is your own operational definition of social distancing? It could be a reduction in the number of times you go to the salon or the market or whatever. I want you to share with me. Answer a couple of questions. You may just win a romantic dinner for two, right? Either at the Airport View Hotel or Movenpick Ambassador Hotel. I do know that possibly today Beatrice and Theophilus Kwashi might be enjoying themselves because they won something a couple of weeks ago. So you're on Ultimate Health Joy 99.7 FM Quarantine Valentine Edition.
Don't get it twisted, love is a beautiful thing. It's Don Jazzy again.
That's right. When they sit, we stand. When they stand, we simply become outstanding. That's why we're joined at 9.7 FM. Valentine edition of Ultimate Health with me, Norte by nature. Yeah, I do have a groovy side. My man Dimanj. So I want to know, how are you keeping safe? At work, at home, in the taxi, in the Uber, in Trotro, at church, salon. WhatsApp is 055 11 11 997. But on Zoom, I have Dr. Michael Owusu, virologist with the KNUST, and also with the Kumasi Center for Collaborative Research. He's been watching the numbers, and more importantly and specifically, watching the virus, and he's going to be sharing with us. Doc, good afternoon. Hello. Hello, Dr. Owusu. Right, I'll sort that out. But I do believe I have Richard Yao Echo, Sales and Marketing Manager of Airport View Hotel. Rich, good afternoon.
Good afternoon, Nee. How are you doing?
I'm doing great.
Can you hear me?
Yes, I can hear you loud and clear. How's your Valentine going?
It's going well.
Right.
Very well.
Right. And we've had your manager, Herbert Kongwe, in the studio a couple of weeks back, and we've been sharing how, patrons to the hotels can stay safe and what specifically Airport View Hotel is doing. But let me start with you directly, Richard. As a worker, a manager, how have you been keeping safe during these COVID times?
Okay, thank you, Nee. Let me first of all say a very good afternoon to your lovely listeners, and also a happy Val's Day to everybody. Now, at Airport View Hotel, COVID protocols is our lifestyle. Since March last year till now, everything we do has been safety across board. Before you enter the hotel, you are required to wear your nose mask, and that is at the main gate. In fact, before you even step out of your house, you are expected to be in your nose mask before getting to work. And our staff have also benefited from a lot of training from the Ministry of Health and Ghana Health Service in the area of infection prevention and control.
Right.
So various departments observe various degrees of protocols. And when you enter the hotel, you will see signages all over, directing you, educating you, encouraging you, and creating the awareness that we are not in normal times.
So you follow that as a worker as well? I've gone to some facilities where you see staff pass through the checkpoints because they are staff. Nobody checks them. Can you guarantee our listeners that this is not the case at Airport View?
Yes, I can assure everyone listening now that before you get to the main gate, even the security himself is wearing a nose mask with a temperature gun.
Right.
Yes.
Okay. Now, let me ask you, Richard. I mean, you commute to work. Do you drive yourself? Do you use public transport?
Yes, sometimes I drive, sometimes I use the public transport.
Right. So just quickly, can you just hit on how you've been protecting yourself and operationalizing the COVID compliance protocols and measures?
All right. So I have extra nose mask in my car.
Okay.
As well as a hand sanitizer.
Okay.
If I am not driving, I have SIM with me, a portable one in my pocket.
Okay.
And I have a nose mask. So then the social distancing, especially in my car.
Yeah.
I make sure that my car is not. Usually I drive to work alone.
Okay.
But in case somebody needs to join me, you have to use the back seat.
Okay.
And when I get to work, I sanitize the handles of my doors. If I want to go back home, I do same. In fact, I need to sanitize properly before I even get home
Okay.
to begin to interact with the family.
Mm.
You know, the little boys will run to you when they see you coming back from home. And you
Okay.
don't need to put them at risk.
So you've gotten your little kids to also comply and follow these things?
Yes, the little boy who is in junior high school one complies. The one that is 1.5 years old, he doesn't even know about COVID. So we try as much as possible to protect him.
Okay. Right. Richard,
Yeah.
I'm going to take a word or two from Dr. Michael Owusu, who's a virologist, and I'm sure you stay on the line, and then later I'll share with your assistants what Airport View is giving our listeners. I know you have a special Val's dinner tonight, and also
Sure.
another package for, is it a one-night stay?
Yeah, that is the private dining for one night stay.
Private dining for one night stay. We'll come back for those details, okay? So, listeners,
Sure.
if you've just joined us, this is Ultimate Health on Joy 99.7 FM, our Valentine quarantine version. I'm giving a couple of things away. You may win a dinner at the Airport View Hotel or a dinner at the Move Pick Ambassador Hotel. I also have a special COVID compliant spa treat, which I'm giving away from Nova Wellness Center. I'll ask a couple of questions when you call us, and you can win that. For this week, again, we're doing this for the phone callers. We're working out the modalities for the WhatsApp participation as well. But Dr. Michael Owusu, good afternoon. Hello, good afternoon, Doc. Doc, can you hear me? Just unmute. Hello, Doc. Okay, there seems a break. Yeah. You can hear me now?
Hello, good afternoon.
Yes, Doc. How are you?
Yes.
How are you in Kumasi?
Good afternoon.
Yes, I spoke to you earlier, and you were busy in the lab. But thanks for making time for us. Hello. Okay, we're having a problem with your bandwidth. So what we're going to do is probably can we switch him to the phone line, Abeku, so that I can take his thoughts. So I'll come back to Dr. Michael Owusu. This is Ultimate Health on Joy 99.7 FM. We're trying to get his thoughts. He's giving some cautions and recommendations with regard to especially the kindergarten school kids. We're seeing an upsurge in the numbers, and we're looking at that. But today we're very interested in how you yourself, individually, personally, are operationalizing the COVID-19 protocols. How do you keep safe? What have you done with regard to social distancing? Our numbers currently are 8,216 active cases, 533 deaths, 718 new cases. And our total confirmed cases, that's cumulative, is 75,836. The last time I checked, China was hovering around 80-something thousand. So we're very soon going to overtake China. Do I have Dr. Owusu on the phone line yet? Yep, he's on the phone line. Okay, right. Hello, Dr. Owusu.
Yes, hello.
Right, this is much better. Okay, now let's quickly look at the numbers, and we've been steadily clocking a daily 700 plus, right? Deaths are jumping. We now have 533 deaths. What are your initial views on this week of the spike, if I can call it a spike, or the second wave?
Yes, good afternoon to you once again, and good afternoon to all your listeners and viewers across Ghana. So you are right. The numbers is quite disturbing. We have 533. I think the last time we had a program, we were doing something around 505.
Right.
But within a space of a week or so, we have jumped to this huge number, 533. If you look at the cumulative death, January, February, you see that we are doing now something close to about 160 or 170 on the average. which is not very good. Like I said the other time, on average of 700 new cases almost every day, with increased hospitalization and increased deaths, should tell us that we need to do more as a people, continue to observe the precautions and step up the things we are doing, not to take this virus for a joke.
Right.
Because if you don't manage things well, you may become a statistic, and that is an unpleasant thing that could happen. And I think that we have to be very careful, like we always say, and take our life, be much responsible, put on our mask, observe all the protocols, and do everything we have to do to protect lives so that we don't, either us or our parents or our families or our wives or children, we don't lose them within this difficult period.
Okay. Doc, the last time we spoke, I think last week, one of the things we observed was that, well, there'd been a tightening of measures, and many were saying, well, give it a week or two to kick in. Are we seeing any indication in our numbers that the tightening of measures is having any impact on the profile of our pandemic?
I don't think so. You remember the last time we had a program, I was saying that the measures put in place should ideally have a net effect on the number of new cases, hospitalization, and deaths. If you follow through from the last announcement by the president, that's his 23rd address, where we had about 416 deaths as at the time he did the announcement.
Right.
And now, almost 2-3 weeks down the line, we have 533. Should tell you that we are not doing any better. Either we, the people, are not observing those instructions that were given by the president, we are not adhering, or the measures are not that strong enough to break the chain of transmission of the virus.
Okay.
If you have a break in transmission, ideally you should have a reduction in the number of new cases by about half by now. We should be doing about 300 new cases by now, assuming these measures were working.
Okay.
And the deaths should have reduced at least by half by now. Hospitalization should have at least been easing to some level.
Right.
Once you don't see these three indicators working in your favor, then it tells you that you have to step up these measures in what we call the suppressive measures.
Okay.
To force these kind of new cases to come down. What you want to say, you want to flatten the active rise in
Right.
this number of new cases. And that is what I think we'll have to do. So left to me, I think that we have to add some further restrictions to reduce the numbers we are seeing. And that
Okay.
is the way we can reduce the deaths which are currently occurring.
Right. Doc, I just want you to hit on that and emphasize strongly on this point. We should be looking at the daily active cases that we are adding, and then we also expected to see an impact in terms of a reduction in the number of critical cases. These are key indicators every Ghanaian should be watching.
Exactly. So the active case count should reduce. The active case count is a reflection of the number of new cases.
Mm-hmm.
So as the new cases go up, your active case counts also go out. And then the deaths. The deaths is the most important thing.
Right.
If your active case count goes down, so if the new cases goes down, your active case will go down, hospitalization will reduce, and the deaths will reduce.
Right.
So the tray is like a three-line plot. If you have to plot this as a curve on a graph,
Mm-hmm.
you will see all the tray rising
Okay.
at the same time, and that gives you an indication that something is not going on well.
Okay.
If things go on well, then you will expect at this time these curves to be falling.
Right.
But once they are rising up, just through heading towards the peak level, then it tells you that we need to do more
Okay.
as a people.
Great. If you just joined us, it's 28 minutes past the hour of 2 on Joy 99.7 FM. My name, Norte by Nature, and the program is Ultimate Health, your ultimate guide to healthy living. Listen every Sunday, 2:05, we are live, and it's Valentine's Day, and we're doing our quarantine edition. We're looking at the numbers. We're interested in knowing and finding out from you, how have you uniquely, individually been keeping safe? What have you been doing consistently? Dr. Michael Owusu at the KCCR and KNUST is telling us that we're not having that desired impact on the pandemic. The numbers are not, pleasing, not only to the eye, but we're hearing other things that we shouldn't be hearing. I have on my screen here, I can see 106 severe cases and 29 critical. And this is the realm that typically turns into very alarming numbers of deaths each time we see the graphs and the statistics. If you have any questions, concerns, WhatsApp is 055 11 11 997. It's Valentine's, so we're giving out dinner for two. COVID dinner for two, well compliant at Movenpick Ambassador Hotel and also at the Airport View Hotel. I'll come back to that. But Dr. Osu, so you say we need more suppressive measures. We need to be suppressed, right? We say when you move, the virus moves. So what are the key things you can quickly share with my listeners as they observe Valentine? We associated the Xmas festivities with an upsurge or a rise in numbers, and this is another celebration of sorts, highly commercialized. What are your recommendations?
Yes, so I think that for us, we have learned some few lessons from last year to now, and I've come to understand that festivities, parties seem to contribute a lot towards surges in cases, especially during what happened in the Christmas and the fact that right after Christmas, we're beginning to see a rise in cases. These new cases we are seeing and the change in face of the behavior of the virus has come about because of so many activities that we were engaging during the Christmas festivities. So anytime there is a festive season of this nature, we have to be extra careful. And for me, the first thing is that you should, as much as possible, avoid gatherings, large gatherings, or even small gatherings of anyhow. If you have to, people have to meet to celebrate Val's Day together, where they have to meet and exchange drinks and do all that. You have to, as much as possible, avoid it, because the stage where we are is not a stage where you want to engage in too much interaction.
Avoid gatherings. Okay.
So that is the first point.
Right.
The second point is that as much as you can, if you have to even go out and do something, if you have one person or two people is enough. But not having 3 or 4 people move around, sharing drinks and doing many things together. I think that this is what seems to, for me, create a lot of difficulties and problems. You may go out there, you want to join your schoolmates, you want to join your workers to share a drink. And by the time you want to share a drink, you want to take off your mask.
Right.
And as you take off your mask, you are chewing some meat somewhere, you are conversing, you are pouring drinks. And before you realize, you just pick something and take it home. And that is how the problem will start. So,
okay.
I mean, if you look at the prevalence of the virus now, out of every 100 cases, we are doing about 30 to 40% from what we are seeing from our facility. Every 100 PCR rounds, you have about 40 of them becoming positive. So you can assume that if you have 10 people moving, 4 of them, you should assume have the virus. So if you have to engage them in a way, you have to be extra careful.
Okay.
And the next point is that you also have to ensure you put on your mask. Very, very important. And make sure that your mask also fits very well. And a lot of people don't seem to learn how to use this mask properly, and it's also not very good. It's fit. Make sure it fits your mouth. There are no spaces. You can breathe, but they don't allow much air or fluids to pass around.
Okay.
If you can put on two masks, is ideal and is good. You can improve the filtration capacity of your mask. And I was even telling a colleague that for those who are high risk groups, 50 years and above, if you can use a filtration mask, it's much better. I mean, because filtration masks have about 95% capacity in filtering these viruses compared to the other lower cloth masks.
Are you recommending and specifying the N95?
Well, it's ideally for health workers and for those of us who are engaged in working in the laboratory. But looking at these variants and the way they behave and the way they are quite strong in moving, if you have funds available and you are able, especially if you live with an elderly person, 50 years, 60 years, who has chronic ailments and he has to go out do some activity, then using an FFP2, I mean, you have lower version of FFP2 mask, I think it is good. You can put on one surgical mask, additional FFP2 mask, and I think that can improve the filtration capacity about 95%.
Okay.
I think doing something of that sort for elderly people who may have chronic underlying ailments can go a long way to protect them.
Right. Okay. These are all individual, personal measures within your own control, within your own radius of, should I say, vigilance. When you mention suppressive measures, should there be, should I say, more higher-handed measures in terms of government or national response policy guidelines? Very quickly.
Yes. So when it comes to dealing with pandemic of this nature, there are two levels of dealing with it. The first level is to, you should use behavior, people's behavior and conduct to control, the pandemic. So this is what we are doing at one level, putting on masks, ensuring that you observe physical distancing, and then do all the things you have to do.
Okay.
The second level is where you have government authorities come in with some restrictions, mandatory actions that will force the population to undergo a certain form of restrictions, as you have seen in many countries. And this, as I said, works because in the early days of Wuhan, if you look at the way they dealt with the virus, when the virus was rising through a peak level, and many people were being hospitalized, many were dying, one of the quick things they had to do is to quickly impose restrictions, some either in the form of curfew or either in the form of hotspots, restriction the movement of hotspots where people are,
Doc.
or lockdowns.
Yes,
so
Doc.
These are a way that governments can do to limit spread and to crash the active rise.
So can I just get you to crystallize that for my listeners before we part, right? You're talking about restrictions, curfews, and what specifically would you recommend governments to do with regard to those ones? And then I also heard a day or two ago you had made some comments or raised some caution with regard to the younger children going to school. Can you just quickly, within a minute, hit on those ones?
So as to what government will do exactly, I think that government has a lot of stakeholders, advisors, people that look at various parts of the economy. It's not just about schools. People looking at the economy, markets, and churches, religious groups, football, and many things. So normally we want to rank all these and see ones that compliance will be quite difficult and deal with it. So I will leave that for government and all the other advisors to consider carefully all the other measures and look at possibly some that we can deal with and perhaps, if possible, touch those areas. Talking about schools, school closure, as I always say, should be the last resort when we're dealing with pandemic. When all other mitigation measures fail, then you want to look at schools. So, after tackling markets, religions, and all that, you want to look at. But when we want to deal with schools, the point I was making is that the tertiary schools are quite disciplined. People would know how to handle masks, learn masks. You can do contact tracing. They can communicate to you. They can tell you their signs and symptoms.
Okay.
Similarly, the adults, senior high school and junior high school, are quite experienced from what we knew from the previous pandemic. But my worry is about the creche, the
kindergartens,
1 year, 2 year. You could see that you don't need to do a study to know this, but compliance at that level is very difficult. And I'm sure that if you have to rank it, you'll be doing something about 60, 40, or maybe 30%, because at any point in time, it will be difficult for them to use masks more effectively. It will be difficult for them to observe all the protocols we have announced. So if you rank the educational system and you see that this is a target group that compliance is difficult, then you are better off closing that part to limit spread of the virus.
Okay.
And also because a lot of them may not be in boarding houses where you can just contain it.
So they are going back and forth.
They are going back to their homes. And when they go back to their homes, they are going to infect the very parents who are taking care of them. So they may be well after a week, after having a few days of cold and coughing, they will recover. Most of them don't actually die. Most people we have tested, they do well after about a week or so. But then the parents who contract this, most likely it may carry them to the hospital, may carry them to the point where they may have to go under oxygen. So this is why I feel that where compliance will be difficult and where it is possible that may act at quick zones for transmission, it's better dealing with that area, and perhaps that can help us to reduce the number of new cases and deaths and hospitalizations we are seeing. It may not be absolute. It may have to be done together with many other variables, such as markets, religion, social gatherings, and many other things which are moving. And I think that if we have to tackle one area in the educational system, this target group of people is an area we must look at. It may be difficult. For private school
Right.
owners and for other children and teachers who may have difficulty. But I think it's for our lives and for our good.
Okay.
If we're able to do this within 2 or 3 weeks, I think it will help us to be able to bring things under control. And when
Okay.
things are better, we reopen for them to go back to school.
All right. Many thanks, Dr. Michael Owusu, for sharing this with us. And we're hoping that there'll be better news when we next speak to you about our pandemic. I have a lot of questions about airport testing and access by air and other ports, but we'll get back to you another time. Many thanks and happy Valentine's Day to you. And stay safe.
Thank you very much, and happy Valentine's Day to you.
Right. Okay. So you're just hearing that from Dr. Michael Owusu. He's saying for every 100 samples they test at KCCR, about 40 are positive. Mr. Echo of the Airport View Hotel, he's given us the cautions, and we know Airport View has packaged something which addresses these cautions. Can we just quickly hit on what you're offering? We talked about the brunch, right? Sorry, the dinner.
Yes.
And then you said what? Private dinner with accommodation. Can we
Private
just
dining.
dining? Can you just quickly
Yes,
hit on
private dining.
what that is?
Okay, so as if I listen to Doctor also said we should avoid gathering.
Yeah, we have about 5 minutes so that we can give away the tickets as well. So if you can just give us
Okay,
the
so
details,
In line with that, you pay 500 cedis, and then you have your dinner inside your room. It's an accommodation package,
Okay.
and then we don't charge you for room service. You have free internet. You get to also enjoy our other facilities.
Okay.
So basically, the private dining is an accommodation package where you are restricted to your room to have your dinner inside.
So that's today.
500 cedis. Yeah.
That's today.
We're not making any profit on this. It's just a giveaway for the public.
Right.
We are not
For
in
serious
the market.
couples.
Yeah, serious couple.
Not the not the one night stands and the hit and run people, right? Serious couples, okay? Right. So that's 500 CDs, and then what? They check out on Monday?
Yeah, they check out tomorrow. So they check in today, 4 o'clock. We have a few rooms, so people can still call and then book.
Okay.
We have a few rooms left to give away.
Okay.
They're almost full, though. But we
Right.
have a
Can you
few
just
rooms
quickly
to
give us the
away.
number so that we can also give away what we have by way of the dinner?
020-225 2228 020-225 2228.
Okay. Right.
So you can call or WhatsApp, and then we block the room for you.
Okie dokie. Right. And we've got a dinner for two, courtesy of your hotel for one of our listeners, right?
Yes.
Okay.
Yes.
That's also
Yes.
with all protocols observed.
With all protocols observed.
Okay.
Wear your nose mask, social distancing. You wash your hand when you get into the hotel.
Okay.
Yes.
All right. Many thanks, Richard Yao Echo, sales manager, sales and marketing manager, Airport View Hotel. We'll be partnering with them to give the messages and keep the messages alive so that we don't drop our vigilance. And those of you who do go there, give us a feedback of your experience. Richard, I'll pass by so that we can actually get a sense. Maybe Abeku will come and take some pictures of what you guys are doing out there. Stay safe.
Great. We look forward to your visit.
Okay. Right. We're still in that mood. If yeah. Right. My phone line is active. 0302216541.
You know the name, right? F-Y-A. When the morning sun sweeps across my room as I wake from another dream of you, you be staring at me, giving me a kiss, say honey, honey, play me a song, super melody, melody. Give me something will say all the baby. Wait, you nyam ya chale. You came along when I was nobody, nobody. Then show me how to be somebody, somebody. Hey, you baba hoye bashi fa oh, I go die with you, get bo bad bo. Feel so bad to say oh, my love, my love, my love. You bring out the best in me. You bring out the best in me. You bring out the best in me. Oh, the touch of your hand. You bring out
All right, I got this one. It says, "Good afternoon, Norte. I ensure that when leaving the house, I mask up throughout my stay in the office. The mask must stay on. I wash and sanitize my hands frequently when I get home. I sanitize all my things, my phone, my laptop, and then I take my bath before entering my room. I also make sure that at home we maintain social distancing. When going to the barber, I ensure that I have my mask on throughout the process and ensure the barber has his on. And I also take vitamin C and zinc. Okay, you didn't send your name. Thanks for sharing that. 0302216541. See if I can give away some dinner. Go with that loved special one. This one says, good afternoon, Norte, by nature. And then the person asked Dua. So we the singles, nothing to even cheer us up, eh? I've listened to you for years. Then you hosted another program in addition to Ultimate Health. You call yourself the Ambushman. It wasn't Ambushman, online ombudsman. And some other plenty stuff. As a teacher, I wear my mask all day. I socially distance by sitting under a tree alone in my school. We've got the Veronica buckets all over the school, and I frequently wash my hands under running water with soap. This is Rusty TM. Rusty, I'll call you, eh? Chale, you've remembered online ombudsman, even though you said ambushman. See if we can sort something out. I have a caller on the line. Hello.
Hello, Mr. Natidra.
Right, I prefer Norte by nature. Can we try that again?
Norte by nature.
Norte, not naughty, not naughty. Norte by nature. Who am I speaking to?
You're speaking with David from Achimota.
From Achimota. David, are you a loyal listener of Ultimate Health?
Yes, please.
Okay, we started this program a couple of years back. Do you have an idea roughly? If you're with one or 2 years off, I'll give it to you. Do you know how long Ultimate Health has been running?
How long?
Ultimate Health has been running on Joy.
No, I can't tell, but I know it's been a long time. I've called last year.
Okay.
I think if I'm not exaggerating,
all right.
last 2 years
Share with me quickly, David, what you've been doing to keep safe. Just 3 things you've been doing.
Yeah, what I do to keep myself safe is that all the time I have a sanitizer with me. I have an extra nose mask so that in case the one I'm using gets spoiled, I can use a new one.
Okay.
And then anytime I'm leaving the office, if the extra nose mask has been used, I make sure I buy a new one.
Okay.
And then when I get to the office, we have a place we wash our hands at the main door. When I get out, I go and wash before I go inside my office.
All right, David. You say you are a loyal listener, right? I have a special spa treat from Nova Wellness Center, right?
All right.
I want to give it to you, but I want you to be able to tell me the name of the doctor who we bring from there and her specialization, if you can.
Dr. Wusu.
No. Abeku, do I have another caller? Yep. David, you want to try again? It's a lady. In fact, for a long time, I haven't had ladies in the studio. She was one of the last ladies I had at the end of the year.
From Wellness Center?
Yes. Okay.
Oh, I don't remember.
All right. Okay. So you don't win the prize, but thanks for sharing your safety procedures and stay safe, okay? All right. I have another caller on the line. Hello?
Hello?
Yes, good afternoon. Who am I talking to?
Okay, this is Kwame.
Kwame?
Yes.
Right. Kwame, where are you calling from?
I'm calling from Accra.
From Accra. Are you a loyal listener?
Yes, on and off.
On and off is not loyal. Kwame, can you tell me the difference between isolation? There's a lot of noise in your background. Isolation and quarantine.
Isolation
and quarantine. What's the difference?
Okay. Quarantine is like they put you in a special place that is designated for COVID patients. Isolation, you can be isolated in your house, so you'll be in your own house, maybe in one room where you distance yourself from others. And make sure
both of them, you are being kept away from people, whether at home or in a facility. But there's a particular difference I'm looking for so that I can give you a prize.
Wow. Okay.
Oh, no? Oh. Okay.
I called because he said he wanted me to also share my COVID, how I keep safe.
Yes, I wanted you to have a chance at winning the prize, but it doesn't look like you're going to get there. So give me your measures quickly. What have you been doing, David?
Okay, so I use the public transport a lot. So what I do is that before I step out, I have extra face masks on me. And the moment I step in a public transport, I scan through to see if everybody is putting on his or her mask.
Okay.
Those who are not, I try to find out. And even those who are not even wearing their masks very well, I educate them and make them put on their masks. And then those who don't have genuinely, I give them. And I take the opportunity to educate them about the virus and how it spreads.
Okay.
So for me, doing this, as time the results I see, I get very amazing. People are receptive to the education and the way you talk to them. So I would like to urge people, those who use public transport and other things, those around you. It's not about you yourself, but it's about those around you too.
Okay.
You can protect yourself, but others, if they don't, you still, expose yourself.
Okay.
So in our own small way, we try our best to educate people. So
Okay.
this is what I do.
Right. Many thanks for calling us, and maybe you can try another time for a prize. I think next week we'll have something to give. I have another caller. Hello. Good afternoon. Hello.
Hello.
Yes. Good afternoon. Who am I speaking to?
Nothing. My name is Ashon.
Your name is
Ashon.
Ashong. Where are you calling from?
I'm calling from Prampa.
Pram, not Ashong, man. Right, Ashong. How have you been keeping safe? Quickly.
We're wearing the mask, having sanitizer, always extra nose mask, and making sure the hands are washed all the time.
Okay, right, great stuff. I've asked two questions. I've asked for the discipline and the name of the doctor from Nova Wellness. Do you know that one?
Is it Dr. Dodoy?
Dodoy?
Uh-huh.
Oh, you're close. Is that a male? Is that male or female?
She's a woman.
She's a woman. Okay, all right. That's great. I'll give you that. Do you know her? Do you know her specialization? What does she do? What is she?
Yes, I think. Wow.
What does she do? It begins CH something.
Pardon me.
CH I think I can.
I know, but it just escaped me. The word is gone, and I'm trying to.
Okay, she's a chiropractor.
Yeah.
Okay, Dr. Dodo, right? Nova Wellness Center. But I think you've done well, right? Abeku will give him the spa treatment at the Nova Wellness Center. They're now near the Country Kitchen in Ringway, right? Great stuff. Do I have another caller? Yes, sir. Hello.
Hello.
Hi.
Hi, Notte.
Hi, who am I speaking to?
My name is Josephine. I'm calling from Kaswa.
Josephine, are you the one who sent me a message from Kaswa saying, I want a gift?
Yes.
All right, Josephine.
Hi.
Can you try the difference between quarantine and isolation?
Wow, that's very academic. Well, we'll see.
Do you know?
Okay, so the difference, I think, they have something similar by separating yourself from other.
Okay, but what is the distinction?
But the difference is for quarantine, you
laugh.
It's when you have when you are suspected of having
Great.
COVID,
Okay, and for isolation?
COVID. And isolation is you just want to keep safe. So
you're spoiling it. No. Quarantine, you got it right. Isolation is Abeku, should I? She's got quarantine right. The other half. Come on, you can do this. Time is ticking. I want to give it to you. Come on.
Oh, please give it to me.
Okay, all right. I'm gonna help you. Okay.
Okay,
I'm
when
gonna
you
give
tell
you.
me, I won't forget that.
I'm gonna give you. I want all my listeners to get something. Okay.
Okay.
I'm gonna give you the dinner for two at Airport View Hotel. Right.
Dinner for two. Okay.
Why? The other half is a problem. I bet we single. Right. So I'll give you that. Okay. Dinner for two, and you got to use it today. Oh.
Okay. Okay. So
Okay.
when Abeku calls me,
All
I
right.
wanted to find out
So-
whether I have to go for that today.
I think to the best of my knowledge, okay, but we'll sort something out. So Abeku, take her details down, Josephine, and Josephine had sent me on WhatsApp that she got herself a small car to reduce her interaction with people. Hey, Josephine, you don't need a dinner for two. You got yourself a small car because of COVID. Several bottles of sanitizer, and I'm sure she uses. I use a nose mask in the car. Okay, I want the gift, so she got that. All right, okay. So we have one last caller. Hello.
Hello.
Yes, who am I speaking to?
Yeah, my name is John, and I'm speaking from Latavia Koshi.
John
From Latavia Koshi.
from Latibia Goshi.
Yes, please.
Okay, right, John. We've had the spa gone out. We've got one dinner left at the Moving Pick Hotel. Do you know?
Okay.
Do you know how long Ultimate Health has been running?
It's over 10 years now.
About what?
Over 10 years.
Over 10 years, but you could do better. Come on.
I can't recollect the exact day, but I know it's more than 10 years.
Do you know when Ghana recorded its first case and reported it?
Yes.
What was the date?
It was in March.
March when?
March 2020.
2020. Do you know the date?
The date.
You should know this. You should know this.
It's 12 March.
12 March 2020. So I'll give you that dinner for two. Do you have a partner, serious partner?
Yes, please. I have a partner.
What's your partner's name?
Sandra.
Sandra what?
Sandra Alote.
Sandra Alote. And what's your full name?
My full name is John Alote.
John Alote. Oh, so that's your
Yes.
wife?
Yes, please.
Okay. So Sandra and John, you get a romantic dinner for two at the Moving Pick Ambassador Hotel, okay?
All right, thank you so much.
My producer, Abeku, will get in touch and then sort out the details. You go have a good time, but observe all the protocols. They do observe all protocols at Moving Pick Ambassador. So keep on keeping safe and spread the message, okay?
Thank you so much.
Right,
Naughty
great,
by
great.
nature.
Right, yes, naughty by nature, but I don't get to go. Right, the sports guys are breathing down my neck. Let me just quickly do justice to the WhatsApp stuff we had, and we'll wrap up. Okay, so Josephine sent me a WhatsApp. This one says, "Good afternoon, naughty by nature. I'm afraid of all because the attitude of Ghanaians who don't care about anything, who still think there's no COVID. So when they see you in mask, they look at you as if you're from Mars." This is from Dan Sokranting in Dawinya. Okay. Very quickly, this is Happy Val's Day. Oh, wow. Day in Maryland. Happy Val's Day to you. The Valley View, no, it's Airport View manager said one must have a mask before entering their premises. Do they have individually wrapped disposable masks to offer patrons? I think they do. Without a mask, yes. Hand sanitizers and Veronica buckets, paper napkins and all that. Yes, I've been there, but we'll keep on checking on the facilities, not just the ones we speak to. So many thanks and Happy Val's Day, Dede. Good afternoon, Norte. I use public transport and I move around with extra mask in my bag. Anytime I join a bus, I scan around through the passengers to see those who are not in mask and who are not properly wearing their mask, and I make sure they do so. I give those who don't have masks, normally very few, I give them masks. And what else does she say? She gives education on the virus. This is a he. Kwabna Obing does that. Many thanks for sharing, Kwabna. I'm really, really trusting God for a lady to marry. I'm single and lonely. Fred from La Paz sends that. Okay, we're wrapping up on Ultimate Health. The sports guys are next with a build-up. And okay, somebody says Ultimate Health has been running for 15 years. Mavis, you're wrong. We've been running for much longer than that. Stick and stay on Joy 99.7 FM. Those of you who won anything, something beautiful from Ultimate Health and our partners, you will be contacted by Abeku Sankofi. Stick and stay on Joy 99.7 FM.
Auntie B.
Customer.
Please, I need something hot to spark my vim this morning. Something sweet and creamy. Do you have Nescafe